Do Republicans think they can repeal health care? And if not, what is their plan B? Joining us live is Republican Congressman Greg Walden. He is the chairman of the House Republican Transition Team. Good evening, sir.
Hey, good evening. Good to be with you, Greta.
Okay, two issues, essentially. Is there a chance that the Republicans think that they are going to repeal the health care?
We're going to do everything we can to repeal and replace the health care bill. This is a job-killing law. We know that from the Congressional Budget Office. We know that from Suffolk University, both of whom said 780,000 jobs could be lost. This is about, let's get health care reform that actually doesn't cost jobs and can bend down the cost curve. This new law does neither of that. It costs jobs and it bends up the spending curve.
As a practical matter, though, you don't have a the president is a veto. He can veto anything
Yes,
you do. I mean, you don't have enough numbers in terms of the Congress. So as a practical matter, this is really more about what you can do to sort of undermine or gut it from a tactical standpoint. Is that fair to say?
Well, I think it's beyond that. First of all, we put out a pledge to America. I've got a copy of it that said we will put up a vote to repeal and replace. So we will do that. We will keep our pledge to Americans.
But you don't expect to win that.
We'll win it in the House.
Well, you win it here, but you won't.
And then it goes to the Senate. We understand those numbers. So then you work on a couple of other things. As you may recall, Speaker Pelosi told the National Association of Counties, you got to pass this so you find out what's in it. Well, guess what? We're going to take the time to let the American people come into these committees. We're going to hold oversight hearings, and we're going to find out exactly the good parts and the bad parts of this legislation. Second, do you really need all the IRS agents this bill contemplates, some 16,500 more? Do you really need the 1099 requirement on small business owners every time they spend $600? I think we can isolate some really bad parts of this legislation. We'll take it to the American people, and we'll see if the Senate roadblocks that and if the president really will veto that.
So if I could be so, I guess, brash, that I mean, you have hearings to have substantive hearings to find out exactly what's in the bill, but at the same time, as you're putting a stick in the spokes to slow down the process.
We can also deal with funding. You know, the purse strings reside with the Congress and specifically with the House under the Constitution. So one of the ways you stop something you don't like is to try and withhold the funding. Now, look, we want to do things to create jobs, not kill jobs. And that's going to be our entire mission. And we're going to expose...
Is it about health care, though, or is it about jobs, or both?
It's both. I mean, I was a small business owner for 20 years. Health care costs are an important component of your business and whether or not you can afford to hire more people. There's a provision in this law that says in 2014, if you're a business with more than 50 employees and you don't provide insurance, you're going to pay a new fine and a penalty. That will mean lower wages or fewer workers. If you're a business that's sitting at 49 employees and that penalty is staring you in the face, are you really going to hire that 50 or 51st employee? I think it has a very downward, costly effect on small businesses and on the job market.
Are we going to see a different type of Congress? Not, I mean, or is it going to be?
Absolutely.
I mean, it's like, is it going to be more like, you know, the Republicans say this is our philosophy, so this is what we're going to do, and it's tough luck Democrats, much like we saw the other way when the Democrats ran it. I mean, how can you work with the Democrats?
Well, first of all, let's open up the process. I've already met with Democrats who were part of the transition last time. Mike Capuano out of Massachusetts, my friend Brian Baird, Democrats across the aisle, who, you know, we worked on the 72-hour rule to open up the process, let people, the press, have a chance to read these bills before they come along.
I
fully agree. It's minimum.
That was not enough time.
But then why do we have 2,000-page bills? Leader Boehner, who's going to be is likely to be the next speaker, the presumptive speaker, has said we're going to break these issues up into smaller parts. We're going to put the taxpayer first and the spenders last. We're going to redesign the way the House works so that it's more open and transparent. Already, David Dreyer, who will likely chair the Rules Committee, has asked the architect of the Capitol to go ahead and install the cameras in the Rules Committee. That's been off limits. All the time Speaker Pelosi's been there. We're going to open up the process, make it more transparent, make it more accountable, let the public in so that they can see us do our work because it is their business.
Am I right that if in the federal court system they strike down the individual mandate, and if the Congress refuses to give funding for the IRS agents to try to figure out who's paying and who's not, that really is the end of the bill?
I think it's a very...
I mean, can the bill possibly go forward without those two things?
Oh, there are other mandates and provisions in there, you know, and so maybe there are parts that can withstand a challenge. I don't know. The long and the short of it is, the way this law is constructed, you're going to blow up the individual insurance market and the small group market because because you're going to wait till you're sick to get insurance. That's the way this bill is constructed, because the penalty is only $600 on the individual. The insurance cost is going to be more than that.
Right,
People
you're better off paying the penalty.
You're better off wait till you're sick, pay the penalty. You're going to game it, and that blows up the market, and that's going to drive up insurance costs for everybody left behind. It is a terrible prescription. It's an enormous new entitlement growth that this generation and the next couple cannot afford. You're talking $300 billion.
Well, I hope that the Democrats and Republicans this time can work together and come up with a good idea.
And we're going to change the system so that we can at least work together in the committees and on the floor in the House of Representatives. We're going to do that in the most bipartisan way we can.
Congressman, I'm going to hold your feet to the fire on that one. Thank you, sir.